Adjunct chemotherapy is a term that's used to specifically indicate when chemotherapy is used alongside of surgery with the goal of cure. So the patients that were involved in this study were patients who had been diagnosed with breast cancer. They had had their definitive surgery for the breast cancer and were now receiving adjuvant chemotherapy in order to improve their long-term outlook. During the period of receiving chemotherapy, there are side effects that are associated with the chemotherapy treatment. Certainly, on balance, the side effects are well tolerated, and the ultimate benefit in terms of improved survival and outcomes in general warrant it. But nevertheless, it's very important to be responsive to the side effects, to manage them properly. We know that family doctors are very involved in the care of all of their patients with cancer. That we've studied quite extensively the extent to which they're involved during different parts of the cancer continuum. But really nobody has looked at this particular interval of time, which is during the active chemotherapy. And it's always been assumed that probably the family doctor plays less of a role during that period because there are lots of visits to the cancer center and the medical oncologist is more actively involved at that time. And it was always assumed that the family doctor was really not too involved during that chemotherapy treatment period. So what we did was we identified the patients of interest through the Ontario Cancer Registry, which is compiled by Cancer Care Ontario and held at the Institute for Clinical Evaluative Sciences. Okay. So we looked at the records of these 8,000 women and linked them with other records held by the Institute for Clinical Evaluative Sciences that allowed us to look at the patterns of interaction either with emergency departments, hospitalizations, or with their family doctor in order to determine what the frequency of encounters was. We were interested in knowing not just how the women themselves, what their patterns of interaction with their family doctor was, but in order to be able to draw any conclusions, we had to compare them to a control group. And so we defined two control groups. One is the woman herself 2 years before her cancer diagnosis. And that allows us to draw a comparison that speaks to her own pattern. And how did her own pattern change during this chemotherapy treatment period. The other comparison was a group of women in the same time period who did not have breast cancer, who were not receiving any form of cancer-related treatment, but were matched on age, on the same age, the same number of other serious medical conditions, and in the same geographical area. So that provided us with two groups that allowed us to compare how the group of interest was different or similar. Surprisingly, the group of interest, those women on adjunct chemotherapy for breast cancer, had 1.5 times the number of visits to their family doctor during that interval of receiving chemotherapy than either themselves 2 years prior or to the matched control group. And so that was a surprising finding because it's always been sort of the received wisdom that during active chemotherapy treatment, there isn't much interaction with the family doctor, that, you know, there's a lot going on, there's a lot of interaction with the cancer center, with the medical oncologist, potentially with the radiation oncologist. And so we didn't expect to see that there was quite a bit of interaction with the family doctor during that period. Of course, the value in this sort of study is to look at ways of intervening and improving the situation. Patients are going to their family doctor during the chemotherapy treatment interval, and so there's the opportunity to engage the family doctor more, provide them with the skills and the knowledge needed to help mitigate the symptoms and potentially to help avoid some emergency department visits.